Hi everyone, welcome, thanks for coming along. If we can just have the next slide please Lisa, we'll make us start. Thank you. Good evening everyone, hi, thanks very much for coming along this evening. My name is Joanne Duncan, I'm a team manager within one of our ELC inspection teams. So thank you for coming along to our fourth webinar in our Supporting the Sector webinar series. And tonight's topic, as you can see here, is taking a learning approach. So thanks for joining us, not just this evening, but throughout the full webinar series. We do have some of you on the call this evening who I know have supported each session, and your contributions and support of one another has been really great. And we know how busy you all are and how hard you're all working. So to take the time out to share that great practice is really appreciated. You're sharing with us what you're doing, the dedicated work that you're involved in with children and families, and it's been a privilege to hear from each and every one of you who've joined in and shared their comments throughout the series, because it allows us to reflect on practice and learn from yourselves. So this evening for the webinar, we're joined by colleagues from the Care Inspectorate. So we're joined this evening by Ros McCardle and Janine Stewart. Ros is the manager of the complaints team and Janine is an ELC complaints inspector. So we're also joined on the call by two of my ELC team manager colleagues. So we've got Lisa Kirkbride, who's supporting us with the tech side of the event. So thanks very much for that, Lisa, the job everybody always wants to avoid. And Karen Quinn is supporting us with answering the chat tonight as well. So thank you so much to Lisa and Karen for supporting the session. So you'll see on the slides that we're using an interactive presentation this evening called AHA Slides. So this allows you to interact with our presentation and it just supports engagement as we go through. There isn't a difference to the slides that you'll see, it just enables better interaction if you choose to do so, and it helps us learn from you as well. If you use the QR code that's on the screen, you can scan that if you've got another device and it'll take you an interactive version of the slides, and we'll show you in a couple of moments how we can use that, because you can also access it by using another web browser with the code that's on the screen. But for now, I'll just give you an overview of tonight's content first of all. If we can go to the next slide, please, Lisa. Thanks. So our plans this evening are to provide an overview of some of the dedicated work that's undertaken by our complaints team. So we're going to be sharing our processes and hopefully develop your understanding of our approach to receiving complaints. But this evening isn't just about complaints, it's about taking a learning approach to practice. And this type of approach is crucial to fostering that positive, high quality environment for everyone, for children, for families, for staff and for leadership teams. It's about finding ways to continuously learn, to adapt and reflect so that it better enables professional development, and in turn that can support improved staff wellbeing. And we heard a lot over the past couple of years about the emphasis that we're placing on staff wellbeing with the Health and Care Staffing Scotland Act that came into effect last year. And that put a spotlight on the direct link between well supported and engaged staff with that high quality safe care for children. And to bring this approach to life, we will be sharing an example with you all later of a complaint that was submitted and how we supported the service to adopt that learning approach. But tonight isn't just for managers and settings. This approach is for all professionals in the sector, whether you're a manager or you're a practitioner that's taken on a champion or a lead role, or if you're a childminder and you're leading your own service. Even if you want to think about it as a piece of learning for children, if you've developed specific areas within your setting, for example, in all of these different situations, the key difference to your normal daytime responsibilities when you lead an area is that the accountability that you've taken for a specific task, and that's what we're going to be looking at. It means that you've taken responsibility for actions. So it's really important when you do that to take time out and review those actions and not just wait until things go wrong. So taking a learning approach is about being willing and consistent with reflective practice. And that can also be to identify positive areas of practice, because that can then be replicated in other areas to support overall improvement and your self-evaluation process. So it's really important to adopt this practice when undertaking any internal investigations or if you're doing a review of practice. And we heard in our last webinar the importance of safe practice and actions that must be completed following an accident or an incident, for example. including the importance of keeping those detailed records of what happened and how these must be shared with parents and other regulatory bodies, including ourselves. So tonight, following on from that, we're just going to give you some further information about undertaking those critical steps to support you to take a learning approach. And our format this evening will reflect other webinars in the series, and we've got an opportunity for the Q&A at the end of tonight's event. But first of all, we can get back to our AHA slides and that interactive part of the presentation. Can we have the next slide, please, Lisa? And I'll just talk to you a little bit more about how this will work. So thanks. So this slide is for us to have an idea of who's joining us this evening on the webinars. I do appreciate some of you will work across different sectors. So if that is you, then you can just select the one that you work within the most. So you can use the QR code. I can see quite a few of you accessing that now. Or if you did want to open another window, another browser, you can just type in ahaslides.com and then / and then the code that's on the screen, YXBWV. So there's a couple of different ways that you can access that. So it's great that we've got a mix of professionals joining us. We've got some from the childminding sector, some from early learning and childcare and school-aged childcare. So there's still some people accessing that. So that's great that we do have a mix of professionals because it allows you to share your individual practice and experiences. So this series has been for everybody. So hopefully people have been able to see themselves in the series no matter what sector you work within. So thanks very much for just telling us a little bit more about who you are. If we can go to the next slide, please, Lisa. Thank you. So to get us started tonight, what we really want to focus on, first of all, is what is working well within your settings. We've had a lot of fantastic examples of good practice shared throughout the webinars. So we want to start by asking you to reflect a little bit on your own practice. So it can be your own practice or your setting as a whole, and just share with everyone what key aspects of practice do you think supports positive outcomes in your settings. So we can go to the next slide, please, Lisa, and we'll just see the AHA slides again. Now, if you can't access the AHA slides, please do feel free to comment in the chat box of this meeting, and we'll also be able to read those out just to make sure that they're included in tonight's event. So if you can just tell us what key aspects support good practice and positive outcomes in your setting. Good relationships with parents, we're just seeing some coming through. I'll just move these over so I can see them. Good relationships with parents, self-evaluation, clear, concise communication, good team, that's lovely to hear. Knowing the context of your family as well, it's so important, a skilled staff team. There's lots coming in now. A big focus on communication, that's brilliant to see that. And we did focus a lot on communication in the second webinar, so that's wonderful. Lisa, if you can just scroll down, please, a little bit, and what we'll do is we'll make sure that all of the different comments are captured in the recording because they're going over a couple of different pages now, so we'll just take some time to make sure we capture them all. Clear leadership, transparency and free communication. Brilliant. If we could just go on to the next page, please, Lisa, see what everybody's thinking about. There's lots about communication, skilled staff teams, whole team involvement and understanding in quality assurance and self-evaluation. It'd be great to hear a little bit more about that as well later on if we could. The two-way communication is so important. And often it's more than two-way, it's all over, isn't it? It's the reciprocal communication, depending on if it's with the children, the families, other professionals visiting the service as well. Is there anything coming out in the chat, Karen?
Yeah, indeed. We've got understanding and respecting each child as an individual, good teamwork again, respecting children's views, good relationships with children and families, open dialogue, encouraged and supported, competent staff working towards the same goal.
Yeah, brilliant. Thank you. And Lisa, I'll just scroll down there. I've just seen somebody pop up there saying child-led. I think that's coming in the chat as well. So thank you very much for sharing those. We'll just make sure they're all captured in the recording so that we can make sure to see them when we're watching that back. Okay, thank you. If you can just go on to the next slide, please, Lisa. Thanks very much for all of the contributions. What we've done on this slide is we've we've gathered some of the key aspects of good practice that have been identified by those who've joined us in our previous webinars in the series, and very, very similar to what's been identified again by you all this evening. And all of these factors, they work together to create that high quality childcare environment that supports positive outcomes for children. We've heard a lot about communication this evening on this slide, and good communication ensures that clarity and consistency. Some of you mentioned about effective leadership and management that's been identified throughout the series, and that provides that direction and helps maintain the standards. And a consistent staff team again has been noted this evening, and that gives clear roles and responsibilities, which promotes that stability and trust for children. And we heard a lot in webinar 2 about partnership working with families and agencies enabling that holistic support. We've then got robust policies and procedures which safeguard well-being and help to guide best practice. You've mentioned about staffing, and effective deployment here was identified, and that's effective deployment of staff which ensures the supervision and engagement with children. Well, your access to training and development, that keeps skills current and improves that care quality. And finally, on this slide here, we've identified a supportive environment that fosters a learning culture and encourages continuous improvement, and that benefits staff and children. So we know that when these areas are going well, the standard of care and therefore the outcomes for children will be positive. However, when challenges arise, they often relate to gaps or missed opportunities in these very same areas. And recognising these patterns or specific areas of challenge helps us to understand where improvements can make the biggest impact. What we'd like to do now is to go back to our AHA engagement and ask of you all, out of this list, which do you find the most challenging in your setting? Now, you don't really have to stick to this list. You can identify your own if it's not there. So we can go on to the next slide, please, Lisa. And we'll just use the AHA again or the comments function just to let us know, what do you find most challenging in your setting? And like I say, it can be from that list we've already identified, or you can identify something else if it's something that you find challenging within your setting or your practice. So partnership working, I'm not sure if that's with families. Your partnership working with parents can be difficult at times. Accessing good quality training. Neurodivergence in children, I wonder if that's the training aspect of supporting children with neurodiversity. Is that what you mean? Consistent staff team and accessing quality training. So there's a lot about training here. Being a lone worker and not able to share responsibilities. Yeah, absolutely. And our childminding colleagues, they do that and they find ways of managing that with being a sole worker. And it's so important to seek that support from your other childminding colleagues as well. Communication with staff has been identified as a challenge here as well. Moving the team forward on a shared vision. We spoke a lot about the importance of that shared vision in one of our webinars throughout the series, because it is so important to include people in creating that vision so that they come along with you on the journey. And quite often, if you see there's been a change of manager and there's a different vision, that can be quite difficult. People are identifying here the challenges of consistency with staffing. Can we go along to the next page, please, Lisa? Because I think there's 2 pages here now. The challenges are coming in. Thank you. The time, people are identifying time. Roles and responsibilities, is that perhaps unclear, roles and responsibilities? We will be speaking about roles and responsibilities this evening, so we can hopefully touch on areas that you find challenging there. Is there anything else coming in on the chat, Karen?
Yes, indeed. Partnership working with other professionals is very difficult. We've got a comment, feeling like we're not worthy and not properly listened to is obviously a challenge, an important challenge.
Yeah.
Meeting the needs of all children with additional support needs, accessing external agency support, paperwork, and not enough staff, and another one for paperwork.
Okay.
I think that's us with the challenges on the chat.
Okay, Thank you. We are going to be speaking tonight about that importance of the culture as well. So hopefully that'll support in some of those challenges that you mentioned there. So often with these challenges, we can't provide a one-size-fits-all solution, but we do hope that this webinar series will support some of the difficulties. But we also want these sessions to be involved in learning conversations at work or spark discussions with your colleagues that will start the conversations to finding a solution to some of the difficulties that you've shared or that you're thinking about. And we hope by identifying where you feel your challenges are, shows that you are already being reflective practitioners. You're already taking the first step towards that taking a learning approach because you're keen to support improvement. And taking a learning approach involves regular reflection, not just on your own practice, but to support child-centred learning as well. So when you're perhaps observing children's play, you might be thinking or asking yourself, why did the child respond that way? Or, how can I adapt an activity to support this individual child's learning and development? So when you think about planning for children's development, you'll also recognise that plans for that aren't rigid because they evolve as the child's interests or their needs change. And that's the same with your own practice when you take this approach. To take that learning approach, it involves being adaptable and reflecting on what is working well and what could further improve. And that's when we're thinking about cultures. You need that supportive culture and settings because those are the ones that encourage curiosity, not only with the children, but with staff teams, so that staff can feel empowered to make those changes. Because in settings who adopt that culture, staff are supported to recognise and accept that any mistakes are seen as learning opportunities. And then that then removes the fear of retribution when things don't go to plan, because they don't always go to plan, and we know that. So this evening, we're going to explore aspects of positive investigations and what they mean for improving care and outcomes. But before we dive into that, we'd just like to start by sharing some information about the complaints team and the processes within the Care Inspectorate, because they are very much aligned with the topic this evening. And that will give us a real clear understanding of how concerns are managed and how that links to learning and improvement. So before we learn a little bit more about the complaints team, can we just go on to the next slide, please, Lisa? And what we want to uncover a little bit is just how you think that you would feel if a complaint was investigated in your service, either by yourselves, if it was an internal investigation, or if it was by the Care Inspectorate. How do you think you would feel if a complaint came in? You feel anxious, nervous and uneasy, vulnerable, surprised, awful. Really, concerning words, and I can appreciate why that is, because we all want the best for children and families and staff. So I could appreciate that feeling of disappointment or worry. Some people are talking about feeling deflated, and we don't want that. We don't want those feelings of deflation when you're working. Everybody is out there doing their absolute best, and we want to try and alleviate some of these concerns just by talking to you a little bit about these processes. Want to shut up shop and hide, and we absolutely wouldn't want that. We want to be able to work together when things do go wrong, because we appreciate things may go wrong, and we need to take that learning culture, don't we? And we can do that together. Okay, thanks for sharing all of that, and being vulnerable this evening with that.
Joanne, there's just a couple
Karen,
of additional comments on the chat. So some people are saying it depends on the situation and would hope that they would be listened to. Someone else has said that they would feel it was very unfair. And somebody else has commented that they've not got anything to hide, so they would think it was fine. And a late one in there is just they would feel it was quite unjust and unfair. Okay.
Thank you. Thanks for sharing all of that. It does give us a really useful insight to understand that. Okay, thank you. If we can go on to the next AHA slide, please. So thanks for sharing all of your own personal feelings there. It is really helpful, like I say, just to give us that insight so that we can be as supportive as possible, because we do want to ensure a collaborative approach to any resolutions and a solution-focused approach, really. What would be really interested as well just now is just to explore a little bit about what do you think would be the outcome of a complaints investigation? So we're keen to explore the expectations around this process. So if you have perhaps never had a complaint investigated by the Care Inspectorate, what do you think are the expected consequences of investigating a complaint against your service? A positive one, an opportunity to learn and get better. That's lovely to read that. Improved practice, improvement for myself, my practice and my company. And reflective opportunity, that's exactly, yeah, that's right. Ongoing support and learning, improvements to be made, self-reflection, training and policies introduced, or support to improve practice, a positive outcome. Depends on what the complaint was. I absolutely appreciate that, yeah, but hopefully a positive outcome. Yeah, it's difficult to identify what you think the outcome would be when I'm not giving you much more to go on, really. I can appreciate that. Find out what we're doing wrong and we don't necessarily know what we are doing was wrong. Improve your practice and support others. Bad press, advice and support, loss of trust potentially. Support from the Care Inspectorate, not coming in, dumping news and leaving with now positive guidance at staff's working environment in the children's safe space must not disrupt that, yep. Improvement and support for our family also. I'm really delighted that actually you think the outcome is that supportive outcome, and that is what we're aiming for. So I'm pleased that a lot of people are identifying that. Improvement on practice identified in the complaint. And again, yeah, absolutely depends what the complaint is about. Is there anything else coming in the chat, Karen?
Yeah, just someone else has said that obviously it could be a learning opportunity, but again, I suppose that, and what they've said is it depends on the situation. I suppose it depends on the complaint. Just the kind of last one here is complaints where the person, I take it that's a complainant, is unknown, is unethical.
Okay, I'm not sure what that one means there. Okay, I think we've managed to capture them all in the recording as well. Okay, thank you so much for all of the contributions there. It's really good insight. Just to have that opportunity to almost have that discussion when we're not in the room, you know, it is really good to try and encourage that hearing from you as well, because like I say, throughout this series, it's just been great to learn from all of you who are joining us. So thanks very much for contributing. So we're just going to go into the part of the webinar series now where I'm going to pass over to my colleagues Ros and Janine, who are going to give you that overview of the complaints processes within the Care Inspectorate, and then Janine's going to come on and just give you an example from practice of a complaint that came in. So I will pass now over to Ros. Thanks, Ros.
Thanks, Joanne. Good evening, everybody. I'm really pleased to be here. My name is Ros McCardle. I am the team manager for the Early Learning and Childcare and for the Children and Young People's Complaints team. So I'm going to give you a quick overview of the complaints team and the processes that we use. And for the purpose of this evening's presentation, we're focusing on the outcomes for children, but we do use the same approach across all of the care sectors. The first question, obviously, that comes to mind is, why do we investigate complaints? And I appreciate all your comments there that you were making earlier, and hopefully we can relieve some of those anxieties and concerns you were raising about when a concern is raised. But obviously we do have a legal duty to investigate concerns, and providers also have a duty to have a clear complaints policy and procedure in place. I won't go into too much detail about that. You can find more information on the website. But the first port of call when people are making complaints, wherever possible, is that it should be with the provider. Obviously, we always ask people, have you spoken to the manager or a member of staff or raised your concern in some other way? This is because resolving matters as close to the source as possible means improvements should be made quickly, and that benefits children and staff. We know, however, that sometimes people will not be comfortable speaking with the service, or they may have tried and they didn't get the reception they were looking for. So in this case, they can come to us and will come to us, and we can provide different options to help them feel more secure in raising their concerns. So people can keep their identity confidential. So we will have their details, but we may keep this confidential from the service. And people can submit anonymous complaints. In this case, they're not providing any personal information, but that does make it more difficult for us to verify the information and sometimes to investigate, as we can't get as many details. I know it's a difficult situation, but we do encourage people to contact us with our concerns. Complaints really help us to understand what's happening across the care sector. And the information we gather during our investigations helps us to highlight patterns and themes and see the experiences of children and what matters to them and to their families. And importantly, it helps us to think about what we need to do to help services improve when things may have gone wrong in a service. And things do go wrong sometimes. Next slide, please. So in well-performing services, we can see that staff will work well together and they'll learn from mistakes. And you should feel confident to raise concerns with your manager, and you can work together to find solutions to the problems. The new quality framework, hopefully the quality improvement framework you've all seen, this highlights the need for staff to celebrate success and learn from mistakes. And that's an integral part of the ethos. And that's also our approach in the complaints team to the management of complaints. Where things have perhaps gone wrong, we will look at whether staff and the management investigated thoroughly and whether they identified areas to improve practice and minimise future risks. That's what it's all about. Sometimes, obviously, staff do not have processes in place to raise concerns, and staff can feel concerned that there is things that are placing children at risk. So other relevant legislation might be the Public Interest Disclosure Act, which you might think of as the whistleblowing policy. And the Care Inspectorate, along with the Scottish Services, I can't even say it, SSC, develop guidance to support understanding of this important protection for employees and for students. Everyone working with children, regardless of their role, has to take action to raise any concerns that they have about the care, dignity, and safety of children who you're working with. We understand people may be anxious about raising a concern. You might be worried it'll affect your relationship with colleagues. You may feel it might affect your career and impact on your progression. You may be treated differently by your colleagues or employer, or worried you might be. Or you may think you're causing trouble for your colleagues, or you may believe that nothing will be done as a result of you raising the concern. But please remember, your role carries with it a significant level of public trust, and your main duty is to put the safety and well-being of children first and act to protect them. When you think about completing accident notifications that some of you might be doing, you might see the question, did this trigger a duty of candour responsibility? Not everyone understands this legislation, but you can look on TOURAS as a really helpful learning module. TOURAS, you can set it up for free, get an account, and it's got a really helpful resource on there that you can use. Next slide, please. So why else do we want to investigate complaints? The benefits of having a clear complaint process is that once it's embedded in your service, you can think about, actually, how do we see this in action? That it's not just a bit of paper that comes out when somebody's saying, I want to make a formal complaint. Actually, if you think about living those values and promoting a culture in your service that encourages reflection and appropriate professional challenge, if you can be open to concerns and not be defensive, if you can pick up on issues before they give rise to a complaint and work together as a team and with your families to find solutions before they escalate, then this culture is also supported by clear policies and procedures, a clear complaint process that is understood by all staff and shared with families and implemented effectively when concerns arise. When we think about how a complaints procedure can provide reassurance, it shows that we understand why people are concerned, that we're taking their concerns seriously, and when families know there is a clear route for raising and resolving issues, they feel their voices matter. This fosters stronger relationships and reduces the risk of mistrust or escalation. Thinking about quality assurance and auditing, investigating complaints isn't just about resolving one issue, it's about learning. Complaints help us to identify gaps in systems, in policies, in staff training, for example, and these insights will lead to better practice that can improve your service delivery and enhance safety for children and families. An essential part of any complaints process, therefore, is good record keeping. If you can't find that incident report or that note that said, actually, I did speak with that parent about that change of key worker, then it's very difficult to demonstrate that you have got the right steps in place. So accurate documentation is really key to accountability. You should have confidence in your settings, policies, and procedures. If you know them well, and you're sure that the correct processes are being followed, but if you notice there's not sufficient guidance, you should feel confident to ask for a review. And that's part of creating your positive culture where staff feel supported. As we've said, complaints and concerns identify trends. For example, if there's repeated incidents, like a child is falling over in the same place all the time, is that risk assessment sufficient? Or do we need to look at it again? Is it about staffing? Are they deployed correctly? Or is there a training need? Everyone appreciates that things can go wrong, but when we follow processes and we keep clear records, we can focus on the learning and improvement side and rather than blame. So this promotes a positive culture that supports both staff and children and helps them experience good outcomes. So we like to think complaints and whistleblowing isn't just about compliance, but it's about trust, safety, continuous improvement. And when we get this right, we can create an environment where people feel heard and staff feel supported and children can have fun. Okay, next slide, please. Just a bit of information about the complaints that we receive. We can receive complaints from anyone. They mostly tend to be in daycare and childminding services, mostly from parents and from staff. You can see the volume of complaints we've received in the last financial year and the relevant percentage for daycare children and childminding services. The number of complaints we receive across the early learning and childcare is about 19%. So obviously more than we'd like, but you can see that in terms of improving outcomes for children, it shows that performing well overall. Only 22% overall the complaints that we received last year were serious enough or assessed as serious enough for us to go out and conduct an investigation. We can receive complaints about anything, mostly about the overall quality of children's experiences, but it can be something like a lack of secure outdoor areas, could be somebody's got concerns about nappy changing, and obviously more serious concerns about child protection and staff conduct. And these may need to be referred to Police Scotland or social work teams or other organisations. You can find out more about the work of the complaints team and our yearly report on the Care Inspectorate website. Next slide, please. So on this slide, you can see the 4 pathways that we use for our complaints process. So intelligence, before determining to log a concern as intelligence, we will have to look at what we already know about the service. So this means looking at notifications, for example, their inspection history, past complaints, the seriousness of the concern, and we always try and speak with the lead inspector. This helps us to decide whether to investigate the concern ourselves or to log the information as intelligence. And intelligence does get shared with services and providers where possible as well. Obviously, one piece of information may seem insignificant, but when we get lots of similar complaints over a period of time, that might start to point to something that's gone wrong in the service. And then we may determine that an inspection might be needed, so we can review those concerns more closely. Also got direct service action, and this is where we can just speak to the service to try and resolve matters quickly. And this might be for something straightforward, something that's quite easy to address, that something's been lost or there's something broken. There's no investigation required as the matter's not really in dispute. So we can just contact the service and ask that they speak directly with the person making the complaint. And this resolves the issues directly with them. We will check with the complainant that they're happy for us to do that and share their details. Provider investigation. This is really important because it gives the service yourselves an opportunity to conduct an investigation. And when the concerns need a more detailed response, so we can ask you to investigate it and provide an outcome to the complainant. And we'd also ask that you send it to the lead inspector. We expect you to potentially follow your own complaints policy and procedures, and the provider response should be sent to the lead inspector so they can review the information. This gives us assurances that the concern has been addressed, and it provides a lot of information about how services respond to concerns. If there's still some unanswered questions, then the lead inspector may want to contact you just to clarify some things. And obviously we can also investigate. So if you haven't had the experience of a care inspectorate complaint team coming to your service, hopefully we try and reassure you and make that process as, well, I wouldn't say good, but as positive as possible. Like we say, it's about improvement and identifying things that we can all work together to improve. So this is only one of the 4 routes that we'll try to use to resolve complaints. When we have investigated and a complaint has been upheld, we will provide minimal information on the website. We can't provide details of the actual investigation, as sometimes that will contain confidential information about children. But you can see something on the website. Okay. So thank you very much. I'm now going to pass over to Janine, and she's going to talk through an incident that occurred in a setting and talk you through the investigation. Next slide, please, Lisa, and over to you, Janine. Thank you.
Thanks, Ros, and good evening, everyone. It's really good to be here tonight with you all. As Joanne said, I'm an ALC inspector who's part of the complaints team, and our focus for tonight is about taking a learning approach and reflecting on practice following incidents or situations that have arisen. As stated earlier, we recognise that sometimes things can and do go wrong, and when this happens, it's about how we respond to that and the learning we take from the incident or situation. To bring this to life tonight, we're sharing an incident, and although it is based on events that have happened, we fabricated it a little to ensure we can give you a more thorough example. To be clear at the start, the event we have based this on, the child was unharmed and there appeared to be no impact on their well-being. On the slide, you'll see a brief summary of the events which I will walk you through. The incident occurred when a child was left unsupervised in the garden near closing time. The child had been outside with other children and staff, and everyone was returning indoors. Once everyone was inside, with the garden door closed over, staff didn't realise that the child was still outside and now there on their own. At this setting, parents waited at the front door while staff brought children out. Parents weren't entering the play spaces and learning spaces at that time. So over the next short while parents started to arrive to collect children, and when the child's parents arrived, staff then realised that they couldn't find the child. Most staff joined the search inside the playroom and couldn't find them. So other staff went to check in the cloakroom area and toilets before someone suggested that they look outside. That's where they found the child playing quietly in a secluded part of the garden. The child seemed calm and was taken to their parent without any mention of what had happened. During this time, the manager was in a meeting elsewhere and wasn't involved in the search, and staff didn't approach the senior covering the managerial duties, so no information was shared about what was happening. The manager only learned of the incident the next day when staff were discussing it, and this was after the child was already dropped off and in the setting. The manager then called the parents to disclose what had happened. The parents were upset by the delay in receiving this information, as it hadn't given them the chance to decide whether they felt confident about their child's safety. Excuse me. Staff were also distressed in the moment. They had panicked, which had distracted them from caring for other children. They didn't know what to do or who to ask for support. Many likely carried that worry home before speaking to the manager. Ultimately, the parents escalated their complaint to us, having lost trust in the service's transparency. Next slide, please, Lisa. So what we're going to ask you to do now is have a think about what steps should now be taken by the manager now that you've learned about the incident. What should they do? And what would an investigation look like in your service? So if you just want to pop comments in using the AHA slides, and again, as Joanne has said earlier, for those who are not able to access the AHA slides, you can pop a comment in the chat. And we'll just wait for those comments to come up. So find out what each member of staff were doing. So yeah, that's really important, is to gather statements from everyone who was there and involved. Yeah. So yeah, gather statements, that seems to be coming through. And find out where staff were deployed in the area. So it's about looking at what's the processes and procedures in place, and we'll touch upon that. Speak with each member of staff, gather statements. And it's so important to get everyone's account.
I'll just read a comment from the chat, Janine, is that okay?
Thanks, Joanne.
Somebody's put establish a timeline of events, which is important. Somebody's said you need to speak to every staff member involved, you need to ascertain what happened, but the important thing that they've also commented on there is to try and be as supportive as you can be. And that's absolutely right. It's not about apportioning blame, it is about being supportive, because this kind of incident will upset staff as well, because they care for the children. They don't mean to do these things. Accidents and incidents do happen, and yes, we want to try and resolve that so it doesn't happen again, but we need to be supportive to the staff. Other comments here are about calling a meeting at the end of the day to discuss, debrief and communicate what will happen next. That's another really important comment, isn't it? About making sure the staff understand what those processes look like so they don't worry. The first thing somebody's comment is to find out who was responsible at the garden, if they checked every possible space before they left the garden. And I think that's about the policies as well. Finding out if there's any CCTV available to confirm events, and somebody else has put in review for timelines. That's all comments. Thanks for that.
Oh, thank you. Yeah. Thank you all for contributing to that. Could we have the next slide, please, Lisa? So why investigate after an incident? And as you've highlighted in those comments, first and foremost, we want to establish what's happened, and that's absolutely key. And from there, we can learn if there are any systems or procedures that are ineffective or missing. We can learn if staff are unclear about roles and responsibilities and if they need more support or training. Working openly and transparently with families is vital. Alert them when things go wrong and share what you're doing to address it. Yes, these conversations can be hard, but honesty builds trust, and it's so important to have that open communication. This links back to webinar 2 on supporting meaningful connections. Good communication gives families confidence that concerns are taken seriously, and most importantly, that they're being heard. And Karen, would you be able to pop a link in the chat to webinar 2? Thank you. If we consider the incident that we're sharing tonight, the service had not notified us of this incident, and therefore, based on the information we received from the parent, we carried out a complaint investigation to determine the facts and identify if we could support a review and rebuild assurance around children's well-being and safety. Had the service notified us of the incident, we would have had the opportunity to discuss it with them at the time, and this may have avoided an investigation. We're not suggesting here that if you submit notifications that we don't investigate, but if you're open and honest when things go wrong, we can engage in discussions and you can keep us up to date of your own investigations. If you find a suitable resolution through that route, We wouldn't come in and double the work if it's been identified to have been a thorough investigation, it's been robust, and it's affected positive changes in order to reduce recurrence. Our aim when undertaking a complaint investigation is to find a resolution. If we do find issues, we may require changes are made to a service's policies or procedures, or seek changes in practice to prevent future recurrences. Often services' own investigations uncover these things themselves, and when we carry out a complaint inspection, what we find are that there's procedural issues and not individual issues with staff. However, if there are any concerns over staff practice, again, the root cause of this is often unsupportive or unclear procedures or policies that steer staff practice. We'll walk you through the complaints investigation that we conducted. So if we could have the next slide, please. So what we found during this investigation is that the service had investigated the incident and identified that a series of events had led to it, but there were gaps in their investigation and it wasn't thorough enough to have affected any changes. Their procedures, processes and systems needed further strengthening, and staff needed more development around roles and responsibilities. What we found that there was no consistent system in place for recording the number of children present. No one had been delegated the responsibility of keeping the daily register updated. This links back to our first webinar on keeping children safe and understanding roles and responsibilities. And again, Karen will pop a link into the chat for this recording. We also found that a head count wasn't done when children returned from the garden. We know how important that is at those transition times to be doing that. A garden sweep was part of the procedures. However, it hadn't happened because there was no clear allocation of the task to one individual. Risk assessments hadn't been updated for some time, and not all the staff were familiar with them. And there was no clear managerial support visible at the end of the day when children were leaving, as not all staff understood who had been delegated that responsibility. Clear roles and responsibilities are vital to help everyone cover all tasks required in order to practice effectively and provide high quality care. For example, if it's not your role to update the register, don't do it without communicating. Helping one another is great and we all appreciate that support from our colleagues, but unclear roles can cause mistakes, so always check with colleagues who's responsible. We uncovered more information about the individual child during the complaint investigation. The family had shared with some staff that the child was a confident and curious explorer and would often wander away from their parents if they were out and about or at the park, for example. But this wasn't recorded in their personal plan, so staff weren't prepared or able to plan strategies to ensure the child was given suitable challenge and able to continue in developing their independence in a safe and secure way. The investigation also found that communication with the family fell short. We know that the service didn't share the initial details of the incident and they didn't fully share the investigation findings or the changes that they were making. The family had to chase for updates and this left them feeling unsure about safety and feeling no reassurance that this wouldn't happen again. These gaps show why clarity, communication and proactive planning are so important. If we could have the next slide, please, Lisa. What we want to help you to do, however, is take the learning from incidents that occur, because we do appreciate that things go wrong. Complaint investigations are not about coming in and apportioning blame, as Joanne said earlier. They're about coming in and reviewing systems and procedures and supporting services to identify where these can be strengthened to minimise recurrence. When staff know their responsibilities and have the tools to carry them out, it builds trust and confidence across the team. Clear roles reduce confusion and help maintain high quality care. If we take the garden check procedure and the risk assessment from our example, there should have been clear procedures that identify if there are any hidden spots or places that small children could fit into. Often children will seek the security of a small space if they feel worried. And if there are any outhouses or play huts, if you have these in your outdoor spaces, then there needs to be clear expectations about checking these. A quick glance is not enough. Everyone needs to understand the risks and check thoroughly. As we discussed earlier, when things go wrong or when we don't get it right, it's not about singling out individuals or assigning blame. Instead, it's about asking what's happened, where did things break down, and most importantly, how can we prevent this from happening again? Because no one wants to be in that situation. Remember the good practice themes that we shared at the start. Learning from incidents helps create a supportive environment and promotes a learning culture. However, this requires reflection, and staff need the opportunity to debrief and process what's happened, and you've highlighted that earlier in the comments. These conversations and the opportunity to have that debrief provide a safe space, because incidents can be upsetting and impact on well-being. Gathering all the facts is crucial, and that means including the right people in the process. So again, it's been highlighted, speaking to everyone involved, and where appropriate, include the children. So this gives a complete picture of the situation and timeline and supports meaningful learning. If we use our example, one of the key findings was that vital information hadn't been captured in the child's care plan. Staff told us when we were in conducting the complaint investigation that parents had said that the child will seek out opportunities to open doors, leave rooms, or go and hide. But this wasn't documented, and therefore no strategies were in place to prevent this situation. As a result of the investigation, additional supports were added to the child's care plan and shared with all staff. So this gave staff the confidence in their practice and their ability to keep children safe. Alongside reflection, communication is key. Families and staff need updates, even if there's little information at first. Be honest and explain if there's any delays and why they've happened, and what the timescales are, and what that means for the timeline for completing your investigation. For example, you might need to wait for a staff member to return from leave to gather their information or account of the event. Or there may be details that you can't share yet, but sharing what you can at that time helps rebuild trust. Next, identify where improvements can be made. In our example, the procedures were reviewed and shared with all staff. A clear system for head counts was introduced, and the risk assessments were reviewed and updated, and responsibilities were clearly assigned, including who steps in if someone is absent. These procedures became a standing agenda item at team meetings, and staff practice was monitored, and where extra support was needed, this was provided. Quality assurance checks ensured that changes were embedded into daily practice so that they could be sustained. Why does this matter? Because having clear documented procedures, even for tasks that seem really simple, creates consistency and clarity. It supports temporary staff or new team members, and even sole workers if you're a childminder. Documenting processes helps identify risks that might be missed if we only rely on mental planning. It strengthens reflective practice and fosters continuous improvement. Thank you, and I'll hand you over now to my colleague.
Thanks, Janine. If we can just go on to the next slide, please, Lisa. Thank you. So thanks very much to Ros and Janine. Ros giving us an overview there of our complaints team, and Janine sharing that example for us. So thanks very much for doing that. We want to touch a little bit on notifications as well. And you've heard throughout this series about the importance of notifications to appropriate bodies, including ourselves. And we do know, and services have told us that there can be hesitation with submitting notifications, and services have told us that they worry that if they submit a notification, it's going to trigger an inspection. But again, like we're saying this evening, notifications aren't about blame. They're about working together for the best outcomes for children, because we all share that goal. You know, we are the regulatory body, so we need to provide assurances that services are well led and managed, and that children and families are receiving high quality care, and notifications help us to do that. So when there is a notifiable event, we're asking for information so that we can check that the right steps have been taken, and if any extra measures are needed, that they're in place to prevent any future incidents. But that's not about apportioning blame. It's about supporting you as a service to reflect on any notifiable events. And we've shared this guidance throughout our webinar series, and I can see that Karen's just popped another link in the chat there, so thanks very much. The front cover is on the screen there of the notification guidance that I'm referring to. So the document itself does walk you through information that you need to include in your notifications, so please do refer to it. I appreciate there does appear to be quite a lot that you need to include in your notifications, but what I would say is don't spend too long agonising about all of the details straight away. If you are supporting an incident or an accident, we want you to focus on supporting the children and families involved, and also the staff. So I appreciate there is timelines, quite specific timelines that you need to notify us by, but you can always provide an update once you have some more time or you've undertaken some of the initial investigations. Just share with us the key things that you think we need to know. We don't need straight away verbatim accounts, and we're not asking for any apologies, because we do understand that things go wrong. What we ask for in the notification is the management of the event. So we don't ask for the outcomes of the investigation straight away. So when we're reviewing the notifications, what we're looking for are assurances that those immediate steps have been taken to protect the ongoing safety and well-being of children, and initially to verify if any medical or emotional support was provided, for example, because we want to check that anyone affected, whether it be staff or families or children, we want to check that they've received appropriate communication and support, and that might be debrief sessions that are planned for the staff or any other follow-up resources. And you might not have undertaken those steps straight away, because we understand, like what we've given in our example, that there will be staged approaches. And sometimes that is a very different approach and a very different timeline to responding to certain incidents. The assurances that we're looking for, like I say, is that the initial steps have been taken to implement those immediate safety measures, and then tell us about how you plan to review any existing processes, and then notify us if any additional control measures were implemented to prevent that recurrence. When we're thinking about taking a learning approach, it involves reflective practice, and that's about including the right people. And we do understand, to do that right, that it takes time. If you're giving us those immediate safety measures, give yourself time for the adjustments to practice and lessons learned following the incident. And then you can use the updates notification, because we just ask to be kept informed of the progress. Once you submit a notification, your caseholding inspector will likely give you a call, and it's at that point that you can discuss and gather some more details if needed, and then you can share where you are with your plans with us at that point. We could have the next slide, please, Lisa. Thanks. So we just wanted to bring this all together, because I've mentioned when you're taking a learning approach, you're reflecting on practice or reflecting on any events that have happened. So when you're investigating incidents, you're establishing the facts and the circumstances that surrounded the event. And as part of this, processes and procedures that are in place are probably going to be reviewed, or they might be updated or tweaked. And that's not dissimilar to self-evaluation. And it's self-evaluation that's a key component for continuous improvement processes. They shouldn't just be one-off activities. And if you're adopting these processes, these self-evaluation processes, it helps you understand what's working well in your service and what might need improvement. So you can support any adaptations before the need for any investigations. And that involves reflection, it involves evidence gathering, and how you plan to improve outcomes. And this all starts with the examples we've spoken about gathering evidence. And you don't have to wait until things go wrong to gather that evidence or take that direct observation. You know, ask the children and families how they're experiencing care, or ask the staff how they feel about working in the service. Develop that mutual understanding, that communication, that valued culture of appreciating everybody involved in the service. And then you can compare your findings against any benchmarks like the Health and Social Care Standards, or there's challenge questions in the new quality improvement framework we're all using. Then if you're basing your evidence, you can develop an improvement plan and test out new practice if necessary. So always ensure that any change is communicated well. And again, like Janine said earlier, that it's documented, because that allows you to review any changes. And as with any investigations or discussions that you've had to complete notifications or undertake investigations following an accident or an incident, make sure you include the right people in that process. So on the screen here, the orange diagram is a step-by-step approach that we've taken from our Evaluation for Improvement guide. You'll also see the image for the new quality improvement framework on the slide. And yes, we're using that for inspection purposes, but it is a tool to support self-evaluation and improvement. And you can use the challenge questions, like I've mentioned, to reflect on practice and ask yourself the key questions. You know, you're thinking about, where are we now? How do we know this? And you're thinking about, what do we need to do next? And that helps identify strengths and any areas for development. And when you know what works well, you can apply those elements to areas that need improvement. And ultimately, this supports staff to deliver high quality care for children. And we shared some information on our social media sites last week to highlight the new FAQ page for the Quality Improvement Framework. And that provides some key information about using the self-evaluation, using the challenge questions. So there's a link in the chat just now, which should hopefully take you to the FAQ page that's on our website, and then you can start to use that to support you in that area as well. Thanks. Next slide, please. We thought it might just be useful to share some information with you to support you if you do find yourself in a similar situation to what's been highlighted today. Now, the SPSO is the Scottish Public Services Ombudsman, and it's got some really good information and guidance to support you with responding to concerns or developing a complaints process and policy, for example. So the SPSO referred to how to make a good apology, and actually that can go a long way to providing people with enough reassurance and confidence that they've been heard and that their concerns will be addressed. So they're then less likely to make a formal complaint, either to you or to us. So hopefully this session has reinforced how important it is to pay attention to all concerns and complaints, but also to pay attention to the compliments and the positive feedback and what's working well. And just remember that effective communication is essential, and that does include, like we've spoken about, recording it. So when a parent or a visiting professional is telling you something that they are unhappy about and would like some further discussions about, try to check and make sure that you have recorded that conversation and where you've recorded it. You want to be thinking about who you've shared that information with. What is the plan to resolve that, and who's going to be involved in that plan? Who's responsible for following up any actions, for example? You'll be thinking about how you're going to get back to that person, how you're going to involve them, and who's going to do that, and making sure that those steps are recorded to just make things completely clear and provide that clarity for everyone. And within your complaints policy, it should be clear how people can then escalate their concerns if they wish to, if you haven't been able to find a suitable resolution. So please, you can use this if it's helpful to review your complaints policy and procedures and make sure that it is visible and known to everyone. We can go on to the next slide, please, Lisa. We're now going to invite anyone to ask any questions or make any comments. So if you'd like to use the hand function, we'll invite you in and hopefully we'll be able to unmute you if we can find you on in the list. Please also feel welcome to turning on your camera if you want to, but there's no obligation because I do appreciate we are still recording, because the recording does allow others to benefit from your questions if they can't attend this evening. Or you can ask some questions in the chat and we'll do our best to go through those questions if we can. Hopefully people can use the hand function. Or if there's any questions or comments, you can pop them in the chat. No questions this evening? We do appreciate it's a lot of information, so sometimes it does take some time to go away and discuss the content and, you know, think about what that means for you and your service and your practice. And then often that's when the questions come. Don't see anything coming in the chat. What we can do is we're going to spend some time on final reflections before we close this evening. So what we'll perhaps do is we can go and just do the final reflections and just do our poll if that's okay. And then if there are any questions or comments on the chat, we can come back to that. So
there's a couple of questions now, yep, Joanne.
Thanks,
well, it's literally once a complaint has been received, how long does it take for the Care Inspectorate to investigate? So probably best to hand that on to our complaints colleagues.
Yeah, Ros, are you still on the call?
Yes,
if you can tell us the timeline, please, for how long does it take the Care Inspectorate to investigate once a complaint has been received?
Yeah, so once we receive a complaint, our timescales are up to 8 weeks to complete the whole process fully. So that includes us receiving the complaint, sort of speaking with the complainant, agreeing the areas that we're going to investigate, coming out, doing the visit, looking at all the information, going through all our processes and thinking about the report, and doing the evaluation, and then obviously feeding back to the service and to the complainant to update them on the outcome of the complaint investigation. So it should be within about 8 weeks.
Thanks, Ros.
Okay.
Hopefully that's answered your question. There's also another comment about the training being accessible or sent in an email. So the recording of the webinar this evening will be posted on our social media sites next week. So that will be available next week, and then it's on our YouTube channel with the rest of the webinars in the series. You're welcome for the link. Somebody's just thanking us for the links. So we can perhaps just move on to the next slide, please, Lisa. What we are really keen to do is just understand if these webinars are useful. There is a question in the AHA slides, but I'm just going to launch a poll as well for people who can't access the slides. So please only answer one or the other. So if you're able to access AHA, you can just close off that window that's just popped up in front of you, or you can use the poll in the window to answer. Just if you can just give us some more information about how useful you're finding these sessions, I'd be really grateful if you're doing that. So I can see people able to access both options, so thank you very much. Okay. Thank you for taking the time to do that. And if we can just have the next slide, please, Lisa. Thank you. We highlighted this at the start of today's presentation that we know there's some really great practice in the sector, and from our experience of delivering these webinars, it's been really good to be able to share theories, thoughts, concerns with one another. So we just want to provide an opportunity for you to share any of your own final reflections from this evening. And if you do share these, sometimes it just helps frame other people's thoughts, or it sparks an idea that they hadn't yet considered. And it's a starter for a conversation that they might have when they go back to their services or when they're working in their services tomorrow. So if you would like, please just share one thing that you're keen to further consider following tonight's delivery.
While people maybe are completing it in the AHA slides, there's a couple of comments in the chat. Just very informative. Webinars are great. I've used these webinars in staff training and they have been very successful, which is great to hear.
Thank you for that. Yeah, thank you. So you're going to be thinking about reviewing policies with all staff. Yeah, it's so important because everybody has a different interpretation. So it's really good to understand how everybody sees things and understands things. A solution-focused approach and an open mind that every day is a learning day, absolutely. But I strive to make a difference every day through my connections and interactions, and I will continue to do this. That's great. And often these webinars are about just identifying to ourselves that actually we're on the right tracks. We are doing all of these things already, and it's just a refresh, and that's really positive as well, because that is all part of being that reflective practitioner and taking that learning approach, because it's identifying sometimes we do need to refresh ourselves, or we just need to learn from one another.
Got another couple coming in the chat saying no 2 days are the same.
Absolutely.
These sessions have been very beneficial, thank you, and webinars do help and are refreshing.
Right. We do hope we've covered everything in the webinar series that will be useful, but if you do have any other topics that you would like us to consider next year, then please feel free to pop those in the chat as well, because we want to make sure that we're supporting you. You're the ones out there with children and families every day, and that's what we want to do. We want to support you. So if there's any other topics, then please just pop them in the chat and we can consider them. More documenting of procedures with clear responsibilities highlighted. I think that's going to be quite a common theme as well. Just about understanding those roles and responsibilities and having that consistency and that clarity does support one another, just to be really confident in what you're doing.
The kind of common theme in the chat really is that the webinars are informative and very useful.
That's great. And that's because of everybody's contributions, Karen. You know, we've just provided that opportunity for people to share the good practice that they're involved in. So it's been really great that we've been able to facilitate that. So thank you very much for everybody to support that. If we can just pop on to the last slide, please, Lisa, just to allow us to say a final farewell. And thank you again for joining us. Like I say, not just this evening, but throughout the whole webinar series. It really has been a privilege to be able to create that space for you all to share your experiences, you know, share your ideas, your thoughts. And there's been some queries throughout the evenings, which has been good for us to be able to have that connection with you all. The contributions that you've given have really made the sessions invaluable. And I hope you do continue to share the information with one another and share the links with other colleagues in the sector that couldn't join us for the live events. Like I say, the recording from this evening will be available next week, but we'll do a refresh of all of the sessions over the next few weeks on social media, just so that you've got the easy access to the links, but they are all on our YouTube channel. So thanks as well to my colleagues, not just tonight, but throughout the whole series. And we all wish you a very pleasant evening.